Today on the Leukopak Lady, I will be talking about FDA requirements for donor eligibility and testing for the allogeneic cell therapy industry. And then I'll touch on the developer requirements that may be requested in addition to these. There are multiple guidance documents for cell and gene therapy developers that outline donor eligibility and testing requirements, but they all point back to 21 CFR 1271, the regulations governing human tissues, or HCTPs. These are donor eligibility for tissue products found in 1271 Part C, current good tissue practices specifically outlined in 1271 Part D, eligibility determination for donors of human cells, tissues, and cellular and tissue-based products from 2007. There's actually a new draft guidance under the same name that was just released in January of 2025 that will replace this when it goes into effect. Considerations for the development of chimeric antigen receptor CAR T-cell products from 2022, CGT Chemistry, Manufacturing, and Control, CMC, Information Guide from 2023, and the Circular of Information for the use of cellular therapy products. To summarize FDA compliance for donor eligibility and testing contained within these regulations and guidance, donors must be consented for donation and all procedures and testing performed using an IRB-approved and FDA-compliant consent form. Donors must complete a donor health history questionnaire, which must assess risk factors for transmitting relevant infections, including high-risk behaviors, exposures, and travel, recent history of certain vaccinations, history of cancers, and other medical history concerns. AABB has put out an HCTP-compliant questionnaire to assess tissue donor history. I will link to that questionnaire in the comments. Donors must undergo a physical examination to assess vital signs, evidence of drug use, skin lesions, and infections. And a sample of the donor's whole blood must be collected to undergo laboratory testing for markers of relevant infections, including hepatitis B and C, HIV, HTLV, syphilis, West Nile virus, and other relevant emerging infections. Testing must be performed using FDA-approved instrumentation and protocols. Testing must be done within 7 days before or after collection. If the donor was tested more than 7 days before collection to determine their eligibility, testing must be repeated on the day of collection or no more than 7 days after the collection to remain compliant. While these requirements are fairly comprehensive, cell therapy developers often add on additional requirements for donor eligibility and testing based on their work with the FDA to approve their investigational new drug applications, or INDs. And based on my experience working with developers who are transitioning to collections and manufacturing under their approved IND, some of the additional requirements include extended health history assessment to evaluate personal or family history of autoimmunity, chronic inflammation, smoking status, BMI, obesity, and other chronic disorders, testing for metabolic imbalances and serological evidence of inflammation, testing for an extended panel of current and previous infections, including CMV, EBV, and other common members of the herpes virus family, Babesia, parvovirus, and others. Some developers even want an assessment of the donor's willingness to return for future donations. After all, if they're spending tens of thousands of dollars to qualify the donor, they want some relative certainty that the donor will return. Collectors at minimum must meet the FDA requirements for donor qualification, but also work closely with developers to meet their specific needs. This may involve drafting additional developer-specific questionnaires and arranging for extended testing through local clinical testing laboratories. And part of what makes the topic of regulations for donor eligibility so complicated is how the FDA defines blood products and tissue products. So come back next week when I break down which starting materials are classified as blood products and which are classified as tissue products, and what this means for the cell and gene therapy industry overall.